Hello everyone. So today we will discuss the next set of principles in bioethics. No? The first one that we will discuss is your principle of solidarity. Now, when we talk of the principle of solidarity, we have to understand first the root principle that comes with solidarity. Now, the principle of solidarity is rooted in the principle of subsidiarity, no? which came from the French word subsidier, or which means to give by way of financial aid. When we say we subsidize something, we mean we aid or assist an individual or community deemed advantageous to the public. Now, this act is made because the donor, yung nagbibigay, sees that a community or someone is not capable of providing for himself or is not self-sufficient, no? And that it needs external help. Now, subsidiarity is more focused with the general need of the public, no? But when we say solidarity, this is specifically focused on the needs of the poor. Now, being sick in our times, no, is considered to be the poorest condition, no? Kasi kung may sakit ka, lahat ng hirap nasa sayo, no? Mahirap kumilos, mahirap gumastos, no? Kasi kapag ikaw ay may sakit, kailangan mong magpagamot, no? When we say subsidiarity, no, is meant as an act, no, to benefit those who have little in the society in terms of healthcare resources, while having solidarity with them means that we are being one and being able to feel the pain and suffering of the poor. Therefore, the deeper concept is the principle of solidarity, because when we talk of subsidizing, we just give them financial aid. But in solidarity, it goes beyond, no? It goes beyond providing financial aid. It goes beyond providing healthcare resources, no, to our patients. No? Because being in solidarity, no, means being we are solid with our patients. Uh, when we are in solidarity with our patients, we are taking part of their pain. No? We are taking part in their suffering. No? This is well reflected then in Christian commitment, no, to concretize Christ's exhortation, no, that whatever you do to the least of my brothers, you do it to me. Now, in our experience for caring for patients, no, it will tell us that the poor are actually the burdened, no, are more burdened when they are sick, no. Lalo na kung compared, no, doon sa mga compared sa may kung anong meron, no? Kung anong doon sa mga taong merong pampagamot. So the poor suffers the heavier burden of being sick, no? Because they have limited resources and as the fact na sila ay may sakit. Okay? Now, in subsidiarity, no, or in solidarity, higher entities of society are called, no, to support the sick person. And if lower levels of care are not sufficient, higher levels of care, no, or of authority or of entities will have to come into play. Now, why do we need, no, to become in solidarity with our patients, no? Because isolating a sick person will only throw him further into weakness because of their vulnerable condition. Okay? Now, in these times of lockdowns, no, sickness, no, it's always good, no, to connect, no, with someone, because uh, these lockdowns induce mental health changes, no? Depression, okay, sadness, because we are isolated, no? So this principle always requires us or encourages us to connect, no, with other people. For us healthcare providers, we are required, no, to engage with our patients because it's one way also to help them recover from their situation. Now, when you are connecting with your patients, always try to consider these aspects, no? Yung sense, yung emotion, and spiritual. Well, the sense pertains to the cognitive, no? Cognitive aspect, no, nung kanilang pagkatao. So, kung paano sila mag-isip, kung paano sila mag-decide, no? That refers to the sense aspect. Okay? when you when you connect, no, with their senses, with their cognition, no, you are acting in solidarity with them. Okay, when you try to help them decide, no, what's good for them, no, trying to facilitate, no, trying to coach, etc., that's dealing, no, that's dealing with the sense aspect, no, of a person. You're being in solidarity with their senses. You are in solidarity with their emotion, no, if you recognize, no, their feelings, most especially the feelings of suffering, pain, okay, depression, no, sadness, no, and so it sabi ko nga kanina, solidarity extends beyond, no, the subsidizing principle. So ito yung beyond na sinasabi ko, no? Being one with them in terms of their senses, their emotions, and their spirit, no, or their need, no, for spiritual care, or their need for spiritual guidance, advice, no. So those are the aspects to consider when you try to connect, no, in solidarity with your patients. The next principle is what you call your principle of moral discernment. Okay? When we say moral discernment, this is the inherent capacity, no, of every human because we are capable of rational comprehension. When we say moral discernment, this is the capacity of a person, no, to determine what is right or what is wrong. Now, education, no, to reason and faith, no, is necessary for us, no, to perfect the sense of what is right and what is wrong. Kasi initially we were given, no, the wisdom of repugnance. No? Pag sinabing wisdom of repugnance, this is our natural tendency, no, to react, no, or to go away, no, to something that is bad. No, this is explained by science, no, because of your fight or flight reaction, no. Now, this is our wisdom of repugnance, no? Na lumayo, no? Or mag-react differently when we are threatened with an inherently evil action, no? That is harmful to us. Okay? Now, to perfect this wisdom of repugnance, kasi wisdom of repugnance is a primordial, no? A primordial function ng isang tao. Now, to perfect this wisdom, no, yung ating kaalaman, our moral discernment, we have to educate ourselves with reason. No? And sometimes faith, and also faith, no, is important. No? Whatever your faith is. Okay? To make, no, necessary adjustments, no, in your way of judgment, no, of what is good and what is evil. Now, sometimes, no, dahil nga there are some principles, no, or there are some circumstances that change the way we think, no. Our discernment can be obscured, no. If our discernment of if our circumstances are contrary, no, you are contrary to what is right or to what is wrong, no, what is good or what is evil, no, our discernment can be flawed. Okay? So these circumstances can come from your culture, no, your beliefs, or incorrect education, no, perpetrated by the society where a person belongs, no. Kaya dangerous din naman pala if you are misinformed, no, into something, no. Kasi it's misleading you to what is right or what is wrong. Okay? Now, despite na there are some uh, incorrect things that obscure or alter our discernment, we believe that human nature is naturally capable of goodness. We are inherently uh, we are inherently directed to do what is good, no? Because of our humanity. Now, for us to make a conscientious and moral discernment, we have to follow these steps. No? We have to follow these steps so that we will arrive, no, to a morally good decision. First things first, you have to start in a prayerful attitude, no? Because when you place yourself in prayer, no, you become conscious, no, of your humble condition as a person. Kasi hindi mo alam lahat. Kasi when you are in prayer mode or in a prayerful attitude, you try to understand, no, the things around you. No? You're just there to seek something, to ask for something. No? You set yourself in humility, making you more receptive, no, to ideas, no, to information around you. Okay? It's like bringing down the walls beside you, no, or the walls around you. So you open yourself. Okay? Number two, you make, no, a fundamental and honest commitment to God and to the dignity of the person, including yourself. Okay? So, always remember when you decide on certain things, make sure that your primary condition or your primary your priority, your first priority should always be the protection of human dignity. Okay? And this is non-negotiable. No? When you decide on cases, always prioritize human dignity. Hindi lang ng iisang tao, no? Pati rin yung mga taong nasa paligid niya. If the if the decision that you will make will affect, no, anyone's dignity, then immediately your decision is wrong. No? Because in bioethics or in healthcare ethics, the primary principle that we always have to respect is the dignity of the person. Kahit nasabihin mong dignity ng person, no, na ang right to privacy ng isang person ay respect, no, sa kanyang dignity. Pero kung yung kanyang right to privacy ay makakaapekto naman sa ibang tao, then that decision, no, to respect that privacy is questionable. Kasi may ibang tao nang naapektuhan, no? Like for example, the case of abortion, no? Many pro-abortion people would tell you that it is their right, no? Because that's their right to their own bodies. But if that right will trample on the dignity, no, on the life, no, of the aborted fetus, then ultimately, no, the right to privacy, no, is has to be deferred, no, rather than to be respected. So kailangan mo pa ring protektahan yung dignity ng lahat ng taong involved sa isang situation. Number three, among the possible options, no, na nakikita mo sa isang situation when you analyze the situation, always seek, no, which one that promote, no, the commitment that you made kanina, which is the respect for dignity, and always exclude those which are intrinsically evil. Okay? Number four, consider your own intentions, and the circumstances may contribute to or nullify the effectiveness of the other possible actions to fulfill, no, to nullify the effectiveness of the other possible actions as means to fulfill one's fundamental commitment. And among the possible means, no, not excluded or nullified, select one which will likely fulfill your commitment, no, to protect human dignity. Now, we go to the last principle, which is your principle of professional relationship in healthcare. No, healthcare is fundamentally a collaborative work. No, it requires the contribution, no, from all healthcare professionals, mapa doktor, mapa medtech, no, mapa psychologist, no, mapa PT, lahat yan, no, mapa nurse, okay? Lahat yan, they contribute equally, no, to the welfare, no, or to the healing of your patient. Now, trust is essentially an attitude of respect, no, and honor given to others in the role of they play in the whole milieu of care. Okay, so this tells us that in a professional relationship in healthcare, the core element in there is always trust. Okay. Now, there are two types of professional relationship in healthcare. One is that which exists between the patient and the healthcare provider, no? And the healthcare provider colleague relationship. Now, relationships in the profession of healthcare can be formal, and sometimes, no, it can be informal. We cannot say that there should only be a formal relationship because symbiotic ang formal at informal relationships sa healthcare. They need to be recognized, no, because this is also beneficial, no, for the patients. Like for example, if there's informal relationship between doctors and nurses, no, medyo they are at ease with each other, they can function well as a team. No? So therefore, we have to recognize that in a professional relationship, there are two, no, dimensions that you need to consider: the informal and the formal ones. Now, in a professional relationship, it can be recognized that each member of the health team has a distinct role, skill, and knowledge. No part, no healthcare provider should claim monopoly over, no, kung sino ang mas may alam over the condition of the patient, because we have our own domain, no, in caring for our patient. If doctors, no, if doctors should not monopolize the care for the patient, nurses too should also despise an attitude, no, na sila ay mas magaling kaysa sa doktor, no, because we are in an interdependent, no, profession, or industry. Okay, so the patient healthcare provider relationship, no, are in this type of relationship, the healthcare providers are viewed as the provider of the service, no, who will understand your patient's condition. Now, one primary requirement, no, for this is that number one, we should be trustworthy. The healthcare providers should be trustworthy, and that there is no breakage of communication between them, and that the patient should put his life in the hands of others when they submit on the care of their doctors or nurse. While the collegial relationship between healthcare providers, no, is also important because this is the helm, no, of our healthcare professionals. No? This states that our cooperation and coordination should be well intact, no, to enhance the work of our healthcare, no, in the noble art of healing. Okay, that instead of competing against each other, no, healthcare professionals should compete on how to combat the disease. Hindi tayo dapat nakikipagkompetensya, no, sa mga kasamahan natin, no? Hindi dapat tayo nakikipagkompetensya mga sa mga kapwa nating healthcare providers. Mapa doktor, mapa nurse, o mapa anuman. Okay? Because for us, no, as nurses, the ICN Code of Ethics requires us, no, to establish cooperative relationship with other healthcare professionals, no, because we wanted, no, to be more cooperative and be more helpful with others so that our patients will be cured immediately. Dinidiscuss din dito sa principle of professional relationship, no? Yung pagcha-charge ng professional fee, no? Meron tayong tinatawag na socialized fee, no, ng charging professional fee, okay, ng PF. It can be a socialized fee. Pag sinabing socialized fee, kung ano yung kakayahang magbayad ng pasyente. Number two, experience based, no? Depende dun sa experience ng healthcare provider. Okay? Kung mas mataas ang kanyang experience, no, or mas malawak or mas maganda ang kanyang specialization, mas mataas ang fee. Kung hindi naman, no, meager fee would be good. Okay? Or it can be another paradigm of charging PF. It can be in a free enterprise approach, no? Pag sinabing free enterprise, bahala yung doktor o yung nurse, no, na mag-charge ng kanyang gustong or kanyang level, no, of PF, no? Or sometimes meron din tayong paradigm na tinatawag na level of difficulty, no? When we say level of difficulty, depende sa complexity ng sakit ng pasyente. That ends my lecture for this week. No, I hope you learned something from me. And if you have any questions, you are free, no, to send me a message or post a discussion post in our Facebook group. Have a nice week.